member of the Leadership and Professional Development Committee, and today I'll be moderating throughout this presentation. It is an honor and a privilege to introduce Dr. Francisca Ako. Francisca is the director of pharmacy at Mountain View Hospital, Las Vegas, Nevada. In addition to a doctorate degree in pharmacy, she has also earned an MBA in healthcare administration, bachelor's degree in economics, certificate in practical nursing, is residency trained and board certified in pharmacotherapy. She is originally from Kumba, Cameroon, where she grew up with 4 of her siblings. She is married with 3 boys. When not working, Franca is traveling with her son's basketball team, traveling around the world, cooking, or just hanging out with family and friends. Dr. Ako, over to you.
Thank you, Harriet. Thank you, everyone, for joining the call on a Labor Day or Memorial Day weekend when you could be partying or doing a lot of other things. We're late as usual, so I'm gonna just get started. So this topic came up because I think after the last convention, we've had a number of questions about board certification and how to go about the process. So before we get started, I'm hoping that overall this presentation will be able to answer a lot of your questions about getting board certified. We will talk about eligibility criteria, really focusing on the acute care setting certification. We'll talk about some of the domains that are tested. We'll review strategies to prepare for the exam and also talk about best practices to maximize your score while taking a certification exam. But prior to doing that, I'm going to just put out a survey. Let's just test your knowledge to see how much you know about board certification and what the requirements are. So I'm going to give you a few minutes to take the survey. So you can use the right side. You could just click on the answers as you go through. And then we'll go through the answers at the end of the presentation. I'm going to end voting in a minute. If you don't know it, just guess. We're going to come back to the questions. So before we get started, just a little bit of history about board certification and where we've been and where we're going. So for over 40 years, the Board of Pharmacists Specialty has been administering board certification examinations for pharmacists. This organization was originally actually formed by APHA way back in 1976, I think primarily just to make sure any pharmacist that's dealing with nuclear pharmacies is really trained and certified to be able to practice. As you can see from the timeline, it kind of took another 10 years before the next board certification examinations were ready, which was pharmacotherapy and nutrition support. And ever since, it's been growing. In the last few years, it's kind of just gone exponential. So the fall of this year, we're getting an additional compounded steroid preparation added. So the examination window is actually open for that. And looking at next year, they're adding solid organ transplant and emergency medicine. So it's interesting how starting off, it would take 10 years and longer when it gets started. And now it seems like we're just adding on as many specialty and as rapidly as possible. So looking at the current status or current state, so far, year to date, we have a total of 11 specialties in which pharmacists are certified in, and counting over 41,000 board certified pharmacists in one of these specialty or the other. And this number includes everyone in the US and abroad. Again, an overview of our current specialty, including the compounded steroid preparations for pharmacists, care, geriatric, oncology, cardiology, infectious disease, pediatric, nuclear pharmacy, pharmacotherapy, nutrition support, critical care, psych. So with the rapid, I just talked about the rapid exponential addition to the Board of Pharmacy specialty. Would ask the question, why all the hype about BPS certification? I think primarily just looking at not just pharmacy, any professional board, becoming certified really is putting yourself way beyond what is the minimal requirement for you to become certified. So the main purpose for any healthcare professional to become certified is really to improve the quality of care that can be provided to individual patients, promote positive treatment outcomes, and also improve the quality of life overall. The Board of Pharmacy Specialty Certification exam puts anyone that's preparing for this exam, certification and recertification, through a rigorous pathway. And whether you like it or not, through preparing for this exam, you really become grounded and expand your knowledge in these areas that you're focusing on. So becoming board certified really guarantees that there is a more than basic level of knowledge that you acquire to be able to practice as a professional. The other effort that Board of Pharmacy Specialty engages in is making sure the members in the Specialty Council, which we'll talk about in the next slide, they're driving the recognition of the pharmacy profession, not only among pharmacists, but amongst other professionals. And they've been working with other organizations, the government, employers, to ensure that the pharmacy profession is getting the recognition that it needs. So board certification also ensures that, or also can speak to the quality of commitment that the individual has to their career, and also would imply they will be providing a higher quality of care to the patients that they take care of. So the question is, why should you pursue a Board of Pharmacy certification? So like we talked about, preparing for the Board of Pharmacy, it makes sure that you're gaining a lot of knowledge that would translate into better patient care. So once prepared for this exam, and if you're able to pass the exam, it would increase your opportunity to become advanced and become specialized in the practice area that you're sorting out certification for. Becoming board certified also enables you to be able to provide comprehensive care to complex patients. And especially in the US, our patient population is becoming more and more complex because we're not typically dealing with one disease state, we're dealing with multiple disease states that are all combined. It also enables that you're prepared for, we're talking about evolving landscape for the pharmacy profession. Getting board certified also ensures that you're getting prepared for this evolving landscape. The pharmacist is getting more and more is being demanded of the pharmacist in the current practice. We're moving away from the dispensing role to more focus on clinical, more focus in how do we become a team player in the healthcare profession outside of just dispensing med. So getting board certified gets you up to date with the guidelines and gets you ready for all the demands that's being put on us as the landscape is changing. Again, we talked about the recognition that you get from other healthcare professionals, for your employers, and also from the patients and insurers. And overall, it makes you competitive in the very competitive market for pharmacists today. A few examples of some organizations that have recognized board of pharmacy certification for pharmacy is the Department of Defense, where pharmacy specialists do receive bonus pay. The VA specialists do get put on a higher pay step or a higher pay grade per se. In states like California, New Mexico, North Carolina, the pharmacist that is board certified is able to apply for advanced privileges. And more employers are awarding pharmacists bonuses and additional pay, additional responsibility out of the fact that they've been board certified. Again, more reasons to want to become board certified. So what does this board certification exam looks like? How do they even come up with the exam? So each specialty is made up of a specialty council, and this specialty council is made up of 7 pharmacists that are certified in that specialty area and 2 other pharmacists that are not specialized in that area. So these board of pharmacy work together, the board of pharmacy specialty work together with the specialty council to develop and administer psychometrically sound and legally defensible examinations. That's just saying these questions are tested and proven to be fair and defendable in the case that you want to contest the questions. So they work together really to develop these questions and be able to administer them. They look at the areas of practice that the questions is being written for and what the duties of that area entails, and making sure that the items that are being written for the exam matches or kind of equate how much time you're spending with each of these duties. The questions are actually written by pharmacists. Once they're written, they go through a validation process. They get validated, they get reviewed, and they get classified. And they're weighted based on, again, how much time in that area that a pharmacist is spending doing those duties around questions like that. So a lot of the times there are questions in the certification exams that are not counted as scores because these are questions that are being tested first out there to make sure that they are comprehensible and they are testable before they actually become gradable. So how do we go about just getting ready for the exam? So this slide actually just contains everything you need to know about getting ready for a Board of Pharmacy Specialty Certification exam. It starts with, do I qualify? When do I take the exam? How do I apply? How do I schedule? How do I prepare for it? And what does the test take? How long does it take to get my results back? What happens when I pass? What happens when I fail? We're not going to go through every one of these steps, but we're going to talk about eligibility criteria, how to prepare for the test, a little bit of that because we are only limited with how much time we can go through each one of these. But I think the essential thing is if you don't qualify, you can't take the test. So we're going to dwell a little bit about the qualification criteria to be able to take the test. So to be able to take this test, first of all, you have to be a practicing pharmacist. And that. To be able to take the test, you have to be a practicing pharmacist, right? So you have to have an active license, be registered in the jurisdiction that you apply, that you're practicing, whether in the US or whether abroad. It's interesting, more and more pharmacists outside of the US are seeking certification exam. I was in a mid-year meeting in December, and there was a session dedicated to just foreign pharmacists. And talking to most of these pharmacies, they're actually board certified, and a lot of them do look up to the US in terms of pharmacy practice as the standard. So I'm thinking to myself, if you have people, the tests are really written for a US based practice and US based population. But if you have people outside of the US who are taking the time and sorting out this certification, I think it speaks volume in terms of those of us in the US who are advantaged to have these questions fashioned after the practice in US to be able to look at why should we not take the exams. So as long as you have a current active license in whatever jurisdiction that you're practicing in, if it's recognized, then the Board of Pharmacy Specialties would recognize that that is valid. In addition to just that, you have to demonstrate that you have experience, real experience in the area that you're sorting certification for. And that could be achieved in a number of ways. But whatever you do, they're expecting that the experience that you gain or the experience that you're using to qualify for this exam should have occurred within 7 years. So whether you're using residency or you're using real field experience, all of that should have occurred within 7 years. In addition to that, so January 2019, the Board of Pharmacy Specialty started requiring a validation or acknowledgement from your employer when you're using field experience. Your employer now has to certify that yes, you do have experience in these areas that you claim to have experience in to be able to take the exams as well. So bottom line, have an active license, be practicing in the area that you're sorting out certification, and about 50% of your time should be spent doing things that are covered in the domains of the exam that you're about to take. And the expectation is that those requirements will be met by the time that you're actually taking the exam. It might not be met, it might not be your third year, but by the time, if you're registering for an exam that's taken in September, the expectation is that by September you should have met all of those eligibility criteria. Excuse me. So we're going to just go down the list of the various specialties which we're really focusing on. Again, acute care specialties, pharmacotherapy, oncology, critical care, peds, infectious disease, cardiology, and nuclear pharmacies. So for pharmacotherapy, the expectation is 3 years of a practice experience, again with 50% of your practice experience occurring in that area, or should have completed an ASHP accredited PGY1. All of these again should be occurring within 7 years. So outside of pharmacotherapy and nuclear pharmacists, all of the other specialty you need to have acquired 4 years of practice experience, or if you did a PGY1, it would be a PGY1 and 2 years of field experience, or you did completed PGY2. So for all those other specialty, the same thing. 4 years of field experience, or PGY1 and 2 years, or PGY2 in that specialty that you're seeking certification for. When it comes to nuclear pharmacy, sorry, it's required to have 4,000 training hours and experience. And the only pharmacist that would get the experience only without the training is a pharmacist that is practicing in a recognized licensed nuclear pharmacy, where an hour counts for an hour of credit. Otherwise, whether you do a residency, you do a training, you do internship, you can only earn a maximum of 2,000 credit, 2,000 hours. The other 2,000 hours would have to be acquired through actual field experience working in a licensed nuclear pharmacy as well. So important to know, especially when we're talking about pharmacotherapy, right? It is really broad. It covers a lot of domains. I know I just talked about when I'm covering acute care setting, but I want you to look at pharmacotherapy. So to be able to do any of these exams, pharmacotherapy, even arm care, the first thing I would require or recommend that you do is actually go through the guidebook. Go through the guidebook and look at what domains are covered. What is it that this exam is looking for? What is it that what does it mean when a pharmacist is specialized or a pharmacist is certified in this area? What does it mean? So that domain, those domains would cover all the areas. So those are the expectations of things that you should be doing, or things that you should have clinical knowledge or specialized skills to do when you're covering those areas. And in pharmacotherapy, it's everywhere. Physician offices, arm care, hospitals, it pretty much encompasses everything that pharmacists do. So do not short sell yourself. Go through the domains and you would be able to quantify in the things that you do. Most of it is direct patient care. A lot of the things that pharmacists practice is really does cover pharmacotherapy. So I do recommend that you go through that handbook and go through the domain to identify what is it that I'm doing now that would qualify me to be able to take the exam. And remember, your employer, supervisor, someone has to certify that those experiences that you're listing, you're spending 50% of your time, not 100%, 50% of your time is spent going through those experiences. So again, just an overview. So now you've checked it out, you've qualified, right? You've qualified to take the exam. What do you do? So this chart says you pick an exam window, apply, schedule, prepare. I would flip it around, because so an exam window would open in January for the exams that are being taken in the spring, which is like in May, April. And the window opens in May for exams that are being taken in the fall, which is like September, October. So if you look at that, and if you're depending on how versed you are with the content material, you might need more than just 6 months to prepare for it. So I would say, once you determine that you're qualified, look at the domain, look at what you need and how much time you would need, and start preparing even before you pick a window on when you want to take it. But I would say look at the content, because if you don't look at the content, you're not going to know how much time you need to want to prepare for the exam before you start taking it. So once you've done that and you've determined, yes, I'm going to take the exam, how do you prepare for it? I'm just going to go over just a few tips. Not These are things that have been validated to work. Really is back just focusing on yourself. You have to really focus on yourself and look at, and really do a self eval to kind of just question what is my knowledge base? What am I good at? What do I know? What do I not know? And again, I think going through that domain that are required will help you be able to do that self eval. And once you do that self eval, you'll be able to identify gaps. And once you've identified the gaps, that's what you're going to use to create a study plan to determine what are your weakest areas and where do you want to focus on. You would spend more time focusing on your weak area versus the areas that you're already strong at. Probably you might just need to spend less time or one day just brushing over those areas while you're saving your time for the areas that you do really need help with. I would also recommend that you take a prep course, whether it's an online based, face to face, or whatever, just take a prep course. That prep course, again, it depends on how, after your self eval, it depends on what you think you're gonna need help with. But taking a prep course, you would never go wrong taking a prep course because sometimes you don't know what you don't know. When you go through a prep course, that kind of opens up areas that you wouldn't otherwise think that these are areas that you need to study for. Again, that prep course will also help you in your self eval to be able to prepare and make a better study plan for the exam. And once you make your plan, you have to write it down. Write it down, have timelines, because your timeline to your plan, you're going to have to hold yourself to it. Otherwise, it just remains in your head and it would never materialize. You want to find a study partner, somebody that wants to speak the same language that you're speaking at the time that you're going through prepping for this. And that partner would also be someone that can hold you accountable. That way, you guys can hold each other accountable, share your timeline, share your study plans, and you guys can hold each other accountable to what is it that you've committed to do. Again, the weak areas you would set as your priority areas because those are probably the areas that you would need more focus on. Put together similar topics to concentrate on and study in sequence. Say, for example, if you're doing diabetes, I would go ahead and do diabetes, diabetic foot infection. Even though diabetic foot infection is ID, I'll kind of congregate and do those things together. That way, I think it would help you better assimilate rather than doing diabetic foot infection separate and diabetes on another day. I'll put them together. That way, light topics you're more likely to remember when you do them together. Each person studies differently. However, it is that you study, just create an atmosphere that's conducive for you to study. Vary locations, minimize distraction. We're all so busy. If you're setting aside an hour to study, you want to make sure that hour counts. Take notes. If you study like you're reading a novel, it doesn't really work well. Take notes, write flashcards, write sticky notes, post them in the bathroom, in your car, in your office, everywhere. The more you see these things, the more you remember, the better it is. It's all about repetition, repetition. So however you're writing, you're reading twice. So just write down facts that you know are more likely to be tested and things that you can easily remember when you write them down. Overall, take care of yourself, right? Sleep, eat healthy, exercise, take a break every 7 days. And if you've gone through pharmacy school, if you're licensed, if you're practicing, you can do this. It's not rocket science. It's not any more difficult than all the other exams that you've been through. I think it's just dedicating the time to do the prep and get ready for this. But I think overall you have to believe that you can do this. And yeah, forget the rumors about the stats and forget the rumors about how 50% of people failed when they take it. This is you. You put in the time, you just believe in yourself and you take it. But you have to believe in yourself to be able to do it. What do the exams look like? The multiple choice exams, two section. Part one, part two, there is a 45-minute break between each part. I recommend that you take a break and just walk out, clear your head in between part one and part two. You're already in session. It's optional. The break is optional, but I would recommend you just take it. You don't have to take the full 45 minutes. Even if you take it 10 minutes, it makes a world of a difference. Take a deep breath and then come back. The questions are written to cover all the domains that were in the content of the exam, but each question doesn't come in sequence as it was presented in the guide content. The questions are random, but all the questions in each domain will be tested. There are a lot of questions, 175 questions. Don't leave any question unanswered. Just guess. And if you don't know the right one, just guess. It's better than doing nothing. There are sample questions in Board of Pharmacy Specialty website that you can kind of look at what that structure, how the questions are structured. So you can look at that. I would also, for study materials, I would also recommend a combination of different things, a combination of question bank, direct patient care topics like guidelines and specific content areas. So ACCP, ASHP are the two key resources that put together prep courses, like study materials for any of the Board of Pharmacy specialty exams. But you have other resources. There is question banks that has questions where you can sign up for on a monthly basis or 3 months, 6-month period. I think the key behind taking questions is really focusing on not what you got wrong, but what's the underlying principle behind the questions and what's the rationale behind the questions. I think it's also a way of studying, and it also puts you sharp with your test taking skills, because a lot of the times you end up going through a test by process of elimination. So I think a combination of all of these is really important preparing for the exam. Direct patient care topics. I think clinical guidelines, as we go, everything is really driven towards evidence-based medicine, and so is the Board of Pharmacy's specialty. All of your landmark trials that are covered in the clinical practice guidelines of whatever, I would say you become familiar with all those guidelines. And the executive summary, in as much as some of these guidelines are like 50 pages, the executive summaries usually gives you the lowdown of what the recommendations are. So I would say read those executive summaries and you will be good looking at those. And talking about evidence, so unlike NAPLEX, the Board of Pharmacy specialty exams are really current with, they're usually very up to date with they're up to date with all of the evidence and all of the recommendations. So usually the fall exams would be up to date as of December, where all of the clinical practice guidelines that were released, you can consider those as present in your spring exam. And the fall exam, you can consider everything all the way up until May to be present in your fall exam as up to date as well. So the next couple of slides, I have resources for each of the board certification. I'm not going to go through each one of them. Most of them are just ACCP, ASHP, and a lot of them are also guidelines from the society, like critical care, pediatrics, for which you're taking the certification exam on. I'm going to leave that on the slide, but I'm not going to go through each one of them. So oncology, but I'm just leaving that there. That way you have resources if you need them, since this slide would be part of the slide that I posted on the website. So I'm going to take us back to the slide to guide us through the process. So we've talked about qualification. We've talked about preparing for it. So once you prepare, you take the exams. It usually would take about 60 days to get the results back. The results are usually posted in, so to even register, you would have to open an account with my Board of Pharmacy Specialty. So the exams results are posted on there. Any score of 500 or greater is considered a pass. Congratulations. Any score less than 500 is not a passing score. But again, it's not the end of the world. The exam to register for is $600. If you do not pass, if you do not have the passing score, you have another year to retake the exam at half the price. So at $300. Again, if anything, I would recommend taking the exam, even if that means just taking the exam to kind of get an insight of what the format of that exam is. I think it would help you get better prepared for the next time around when you come back to take the exam. Other than that, I think that's about everything. I will take any specific questions, but before we do that, let's go back to our questions that we took before to see what we did or how we did. I thought I could post the results from the previous exam. All right, I'm going to end the voting in a minute. All right, I'm ending the voting in 1, 2, 3. Right. So let's go through the questions. What two certifications are anticipated to be launched in 2019, 2020? 57% solid organ transplantation and emergency medicine. That's correct. So that's everyone. How many pharmacists sit on the specialty council for each board specialty? 7. So we have both certified and non-certified pharmacists that sit in the board. Each candidate for certification has to be current active license registration to practice pharmacy in the US or other jurisdiction. That's true. And the last question, which board certification requires 3 years of practice experience, including 50% or more of that time spent in the domain described by the content outline? And that would be pharmacotherapy. And that would bring us to questions.
Dr. Aqua, I have a question here from attendee. She asks, where can we get the guidebook for the pharmacotherapy, please?
Thank you. The guidebook is, you can find the guidebook in under BPS, Board of Pharmacy Specialty.org. So once you select pharmacy specialty, whichever one you're interested in, you would have the guidebook along with it.
Okay. I cannot see any other question on the comment section, but I have one more question. Concerning the points, like does each question carry the same points, or some of them have more points than another? Do you know?
Each question carried the same point. So when we talk about weighted,
Mhm.
the weighted will come from the number of questions from that domain. So the domain that's highly weighted will have more questions than the domains that are not highly weighted. So each one would be the same number of points. So that's why every question is game. And there are no cutoff as to how many you must score in this domain to be able to pass. There's no minimum. It's an overall aggregate score. So the areas that you're really good at, you want to nail all of that. The areas I always talk about for stats, math is always where there are no similar answers, right? You just have one right or wrong answer. It's the easiest thing to make sure you get all of your points. Where if you spend time and just nail it down, you can be guaranteed that you're getting all your points. And then you spend a less amount of time gathering points from the other domains.
Okay. I'll encourage everyone to start typing in their NABP number and also their name so that we can make sure they have their credit hours. And I have another more question. Somebody is asking which one is best, to go through a residency program or just to get a certification.
Each one is different, right? Again, each one is different, depending on what you're looking for, and depending on which organization you work for. More and more, for a lot of places, a board certification is kind of equivalent to residency. But there are more and more organizations that would still require a residency and board of pharmacy specialty. But whether you're residency trained or not, more and more organizations are requiring that additional certification. So I think ultimately, whether you're residency trained or not residency trained, the requirement and the expectation of becoming board certified, you can't run away from it.
All right. That question was from Facebook Live. Another one from Facebook Live, but somebody's asking if a pharmacist nutrition specialist board exams are also available.
Yes, that's the BCNSP, nutrition support pharmacist.
Mm-hmm. All right. We have another question on the chat forum from um. So if I work 40 hours a week, and let's say I volunteer at an oncology clinic or hospital for 20 hours a week, would that qualify me to take the certification in about 4 years?
For oncology certification,
Yes.
you mean? So 20 hours. So it's about how many percent of your time is spent, right? It's not about your total number of hours. It's about
Okay.
how many percent of your time is spent doing providing care to patients. For example, for the oncology certification, most of the domains actually require direct patient care for patients that with ongoing oncology or complications from cancer. So it's about how many percent of your time when you're there. So if you're doing 20 hours and you're spending 100% of your 20 hours providing direct patient care, that should count, right? It's not about doing 40 hours a week. It's about what area are you practicing in and how much percent of your time when you're practicing is spent providing care for these patients. So the other thing to understand is that they want you to be able to provide higher level of care. So if you find yourself in an area and that's your area of practice where you're spending 100% of your time while you're there providing care for this patient, then it's justifiable to want to improve your knowledge to be able to take better care of these patients. As long as you're able to document and have a supervisor validate that you're spending that percentage of your time doing providing care for those group of patients and doing those things, so yes, you would qualify to become to take the oncology certification exam.
Okay. Um, I'm not seeing any more question. Please, guys, just go ahead and type in your name and your NABP number, please. Okay. Thank you very much, Dr. Ako, for the presentation.
Thank you, everyone. Thank you so much. And feel free to reach out to me if you have any additional questions.
Yeah, one last question. Somebody is asking that hospital pharmacies and specialty pharmacy may qualify for most of the board certifications. Where do retail pharmacies stand?
Retail, you still qualify, so you do what is your patient population that you take care of, right? You do qualify for pharmacotherapy. So look at the domain. Do you provide medication therapy management? Do you provide counseling? Do you provide referrals? Do you have a collaborative practice agreement? So you're still able to provide these kind of services. So you can qualify for pharmacotherapy, you can qualify for geriatric, you can qualify for ambulatory care. Again, depending on what type of retail, if you're doing specialty, you can qualify for sterile preparation, if you're providing those kind of products to the patients that you take care of. So if you do provide sterile compounding, yes, you can qualify for that as well.
All right, thank you very much. So next in July we have our second annual convention coming up in July. I will recommend that if you have not registered, please go ahead and register. Last year was great, and this year is going to be even better and greater because we have individuals and committee member working behind the scene to make sure that we have the best of experience. And we have as one of our keynote speaker, Agatha Achindo, which she's going to be talking to us on that day as well. And we have a lot of programs. Detail of the programs will be coming out soon, but we have a lot of program lineup already. And also next month we have a webinar coming up on June 23rd, and the focus is going to be on ambulatory care board certification. So this was for acute. So for those who have like those the retail pharmacies and other areas, we can also come and learn something as well. Please, guys, if you have not already type in your NABP number and your name, please go ahead and do so. And don't forget to follow us on Facebook and on Twitter as well.
Thank you, Harriet. Thank you, Sidoni, for all your help with putting this together. I really appreciate it.
Thank you.
All right. Enjoy the rest of your Memorial weekend.
Bye, guys.
Bye.